Offerings at Northern Light Cancer Care are expanding in the coming months after they received one of their largest gifts. Grace Bradley brings us to Brewer for more.
This is the future of cancer care, and we're excited to deliver this care right here in the state of Maine.
Northern Light Health unveiled Wednesday their latest step forward in oncology care as they announced the new Jim and Kathy Jarrow Center for Genomics and Advanced Therapies at the Lafayette Center. This is made possible through a $10 million gift from Jim Jarrow in memory of his late wife Kathy, who received cancer treatment at Northern Light before passing away in 2022.
Genomic medicine is the current way we treat patients. It's the future. It's rapidly expanding. And when we talk about genomic medicine, what it means is that we are studying the biology of the tumor, looking at specific mutations within the tumor so that we can learn more about the tumor and what targeted therapies may be most appropriate and most effective for the patient. It helps us plan current therapy and future therapy, and it helps us identify who is appropriate for targeted therapies and clinical trial enrollment.
Cancer medicine, treatment, diagnoses, outcomes just continue to evolve at a rapid pace, and this is great news for patients. We want to make sure that we're in a position to provide these advancements to our patients.
Personalized care means a lot of different things. In my case, it was much more easy to tolerate, and while I spent a long time receiving that targeted treatment, I was able to live my life, and that's what our clinicians want for our patients.
This vision is built around a simple but very powerful belief that every patient deserves hope, every patient deserves access to the most advanced treatment options available anywhere.
One of the most remarkable things of the work that we do is encountering families who come to us to want to do something good in the aftermath of agony. Both of us agree chemotherapy is brutal, and we hope that we live to see less chemotherapy and more cures.
Grace Bradley, WABI News, Brewer.